it's good to see you again.
So,
Can you just introduce yourself again?
sure. I'm Matt Sumner. I'm the owner and lead dentist up here at Accent Dentist, where we like to call ourselves the home of the smile makeover.
And Matt, can you tell us about a patient you saw this week and what brought them in?
Absolutely. This is a patient of ours, Stu. Stu's a great guy. He's a bit of a high flyer. He does CEOs and board roles, and as a younger guy he played a lot of rugby. He's from Southland, and Stu as a young man had broken his front tooth in a rugby accident, and somebody had put a big metal post up inside that tooth because he'd snapped it off quite high. And then through work and the stresses of what it was that he was doing, he used to grind his teeth quite a lot, so it was popping bits and pieces of tooth structure off and was wearing and hollowing out things.
And Matt, how did you choose this treatment option for Stuart?
Well, in a case like this, there's relatively limited options. Certainly with tidying up the crown on that front tooth, there's not really a lot of other things you can do other than make another one of those. And yes, we could have explored some composite bonding situations here, but that material's not really very strong. So if you're putting it in a situation where somebody's in quite stressful scenarios and they're grinding their teeth a bit, the likelihood of it lasting there's not great. So a ceramic solution in there is a good one for someone like Stu. So we ended up putting veneer on here, and here, and a new crown over this one because this tooth takes a lot of load. So we needed something stronger on there. The tricky one in this case is that tooth because there's a big black metal post up inside there. It goes all the way up inside the root of the tooth. And to get that out is very, very, very difficult without potentially disrupting the root filling or any of the foundations of that tooth, so you really want to leave it alone. But to get a nice aesthetic finish on a case where there's a big black post in there, you have to hide that. So in a case like this, we actually made two sleeves, one that went over the post to mask it so that you couldn't see the darkness from it, and then another crown over the top of that, which enabled us to hide the black post and also get a really nice aesthetic finish at the end.
And Matt, what was Stuart's response by the end of his treatment?
Well, Stu really did this because he didn't feel comfortable rocking into high-profile meetings with a smile like that, and he was pretty stoked in the end, in his classically understated way. What he particularly was happy about is because this was a rugby injury and in his younger days, we were able to get ACC involved in that for him as well, which reduced some of the cost on it. And I think Stu probably feels now like he can dominate his board meetings pretty happily.
And Matt, if people are wanting more information about Accent, what would you tell them?
Well, we've got a great range of case studies on our website, so you should certainly stop and check that out. It's www.accentdentist.co.nz. There's a whole gamut of different bits and pieces that we've put together for people there. It's a great resource, and if you've liked this video, you could like and subscribe to the channel.
Okay, perfect. Thanks, Matt.